Hi guys, Joel Palmer here at Vintage Fitness Studio, Vermont. I just want to talk a little bit today about hip injuries, ITB Syndrome, very common thing we see, creates a lot of hip pain, can also cause a lot of knee pain. The IT band attaches across the top of the pelvis, runs over the hip joint down the outside of the thigh, and actually attaches just below the knee. So you can oftentimes get knee pain, hip pain, lateral thigh pain, very common injuries, see a lot in athletes. Something we run into, and try to give you some ideas here of simple things you can do at home to take care of yourself. First thing I always suggest is if it's very acute, if you're having a lot of pain with it, go get it checked out. You might need some acute treatment first for a week or two, or maybe even a couple of weeks. That might include stuff you do for yourself at home, or maybe some medical care, or most definitely some hands-on care, whether it's your therapist, your chiropractor, your massage person. You may need a lot of that first, just to get you over some of the acute stuff. Take care of the acute pain first. Try to get things to calm down a little bit. Lots of ice. Rest it. Avoid things that tend to agitate it once those are identified. Soft tissue work to try to flush that area. And then after that, you can maybe move on to some simple home rehab that you can do. One tool I like to use, good old foam roller. We've talked about this in some other videos. This is sort of the wider diameter ones as opposed to the narrow ones. It's just a little easier to get on top of this one, especially for things like your hip. I like the contoured ones. Studies have shown that it's a little more effective, it gets a little deeper into the tissue, although the smooth ones do work, so if you have a smooth one, that's fine. One little warning, a lot of my patients and clients will tell me that some of the rollers they use are too hard, and the ones in particular I'm talking about are they're plastic. If you look inside, it's like a plastic tube with foam sort of glued to the outside of it. So just beware that those might be a little hard, especially when you're acute. The full foam rollers actually have a little bit more give, so they're a little more, I think, body friendly when you're in acute discomfort. One thing we do with the roller is we try to roll out that IT band. So one of the things we do is you just put it right down on the floor. You gotta get down on top of it. The affected leg, the sore leg, goes on top of the roller. Your other leg will just cross over, you plant that foot, and that helps you to put more or less pressure on the roller. And then what you do is you just sort of roll out that band. You need to identify some of your most tender spots first, and then you gotta hit them. You gotta roll on them. I know it's tender. You try to lighten it a little bit and take the pressure off if you have to, using your hands and your other foot. If you need to get down closer to the knee, you just shift this down a little more to the knee, and there you go. Get a nice little side plank in here at the same time. So there you go. All right. So foam rolling is a great way to work that little IT band issue out. After you foam roll it, sometimes I'll have clients or patients just ice it for 10 or 15 minutes as well, just to try to keep the inflammatory process subsided. So you work it hard, and give yourself just, I mean, it's not like you have to spend a lot of time. 2 or 3 minutes rolling can really go a long way, but you gotta do it consistently every day, okay? So you may have to do that for a while, especially when you're talking with something like an IT band. Things of that nature are sort of tendinous in nature. Tendon stuff takes a long time to heal. You just have to be patient and keep working it, and then work in some exercises once you start feeling a little bit better. All right, as far as exercises go, a couple simple things. You can do some things just simply without any tools, and I'll show you a couple things with the tools. Some of your classic ones, if you're working that IT band, obviously sideline, you're just doing some side leg raises. What I like to do is also just play around with my foot placement. So if my toe is pointing straight towards the camera here in a neutral position, you can do a few reps that way. You can also turn the toe up a little bit, just hits the muscles in a little bit of a different angle. Okay, you can also go toe down a little bit more. Okay, toe down a little bit more. And do about a dozen repetitions. And how high you raise that leg depends on your pain level. If you're getting a lot of discomfort, keep your pain level, or keep your leg within the pain-free zone. So don't force yourself to go beyond the pain point. It'll come in time as that tissue starts to respond and heals and gets stronger. So in the beginning, if all I've got is a few degrees here, fine. That's where I work. That's my pain-free zone. Hopefully as I get better, my pain-free zone gets a little bigger until, you know, I can get pretty much full range of motion. Okay? Another exercise is something called the clamshell. Again, if my painful hip is the left IT band, we kind of curl up, sort of fetal position, right? And then we're just opening up like a clamshell. And in the beginning, believe me, just that is sometimes enough of a challenge for people. Right there, just a clamshell, okay? And what I would do is roll over, do the other side once this side is done. So do about 12 repetitions. Like I said, you don't have to go crazy because you're gonna add them together. So you'll do 12 lateral raises and then you'll do 12 clamshells, okay? If you need a little bit of resistance, good old-fashioned TheraBand works well, okay? This is a long one. You can use a shorter one. You know, I'm gonna just double it up, right? We'll just double it like that, okay? So if we're doing a clamshell, say, we put that around our knees, right? And now as I do my clamshell, I've got a little bit of TheraBand resistance going, okay? A little bit of TheraBand resistance. So I would suggest you get to full range of motion first without the band before you move to the band, okay? Interesting fact here too, if you shift that band, you see it's sort of over my mid-thigh, you put it out here over your knee, changes the leverage, it's a little tougher, okay? A little tougher, adds a little more resistance, okay? You can do the same with the lateral raise, okay? You can anchor it a number of different ways. You can use your hand, you can use your other foot, right? You can use your lateral raise that way, okay? So that can add a little resistance if you need a little resistance, okay? I also like to use the TheraBall. TheraBall, here's a very effective tool. This works some of the opposing muscle groups. So a lot of times you've got IT band syndrome here, but oftentimes what we find is we've got some weakness on the adductor side, so on the inside of the thigh. So here's a simple one. You lay with the ball right between your knees, right? And then all you do is you just do an adductor exercise. Squeeze, relax, squeeze, relax. So it's sort of the closing of the clamshell, if you will, right? Squeeze, relax, okay? If you want to add a little more gusto to it, you can do it with a bridge. Pulse your bridge up, squeeze, relax. It's a great way to work the adductors. It works some of the deeper pelvic musculature, works some of your core muscles as well. Bridge, squeeze, okay? Again, I usually stick to sets of 12 reps. Do 12 reps, see how you feel. If 12 reps is really easy, go back, add another set. It's that simple. One other thing I like to do is to try to stretch this IT band, and that can be a real nuisance trying to stretch it. One stretch I really like, but takes a little assistance, so you need either a band or you could use a belt or a rope or whatever, is we lay, what we want to do is we bring the affected leg up, we bring it over, and we use the band to help stretch here, right across here. If you can do it without the band, some people, you know, can do it this way and they feel it, but oftentimes what we need to do is we need a little internal rotation of the foot, and so I can't reach my foot, so we use the band, we hook it on the outside of the foot, and it naturally internally rotates, and I can feel that a lot on my IT band. Let me show you from a different angle. We would come across and bang, there it is. And I feel that right through here, okay? If you don't like that one, another one that we use a lot is sort of a modified, sort of dragon lunge, if you will. A lot of people also use it for their piriformis. But what you do is you come down, you cross over. So the one I'm stretching is the front knee. You cross the back leg over, and then you just sit into that hip. So you're sitting, almost like you're sitting into that hip. Okay, and that's another way to try to stretch that IT band. Show you from a different angle. We sit back, right? Cross the leg over, and here. Just sit into it. Okay? So these are all effective tools, effective ways you can work your IT band, or in general, just some hip discomfort. Okay? I'm going to show you one more technique. I've got to take a little break with the camera and set it up. It requires a heavier duty band, but I just want to show you one little technique. This is a technique I gleaned from a gentleman by the name of Kelly Starrett. You can find him on YouTube. He's got some great stuff on YouTube. MobilityWOD.com. That's mobility. WOD is WOD.com. If you go check him out, he gives you all kinds of ways to mobilize difficult joints or chronic joint issues. I'm going to show you one that I really like for my own hip. I do it myself. And give me just a second. We're going to set up a little differently here, and I'll show you what I'm talking about. Okay? Be right back. Okay, gang, so here I am. I'm going to show you that Kelly Starrett technique for helping to reset and open up your hip joint a little bit. If you're somebody who feels like when you squat, you feel pain in your groin or your hip, sometimes what's happening is things are getting too impinged in that hip. Oftentimes the deviation is the femoral head will shift too far forward and internal, so jamming up sort of in the groin area. So a lot of times people find that as they start to squat, it sort of impinges. And I can tell you this is a common problem for a lot of athletes, even really good athletes. I can tell you I struggle with this issue myself. I started looking for some answers for my own training to help me squat better, have better range of motion through my hips, maybe get a deeper squat, and this has helped me out a tremendous amount. So I'm going to just show it. It's very simple. What it requires, though, is a heavier than normal TheraBand, the whole looped band. Okay, I've got mine just anchored to my station here on the pole. You can tie it around something if you've got a gym apparatus or something you can tie it to. You need something solid to anchor it to because you're going to be pulling on it pretty hard. What you're going to do is you're going to step through. So I'm going to treat my right hip. You're going to step through, pull it up high in the groin. What you want to do is try to pull that femur head back and just a little bit lateral to sort of open up that hip joint. So what you're going to do is you're going to just come forward and get as much tension on it as you can. Okay? Drop down. And then all you're going to do is sort of just kind of wiggle. Hold this position. You got to give it about 2 minutes. You're going to practice coming forward a little bit. You want to practice shifting your hip laterally, medially, back and forth, right? I would give yourself a good 2 minutes just doing it in this position. Then what you can do is pivot yourself just a little bit here, this way, okay? It's really going to help sort of open up that hip joint. Again, get some tension on it, and then you can just lean into it a little bit. Allow it to just draw your hip joint open. Sometimes you need to get a little bit of rotation. You just take your lower leg and rotate it out a little bit. Lean in. Just help pull open that joint space a little bit. Okay? Again, about 2 minutes or so. And then you just back out. And if you're like most people, you have bilateral problems, do the other hip as well. So try that one. Maybe go check out Kelly's website, mobilitywod.com. Great site, can't recommend it enough to you. He's got some great ideas. He's a fun guy to watch online as well. So there you go. So simple tools for some hip rehabilitation. Try them at home. Try them in your gym. Just try them. You might have to make it a regular thing for a while if you're dealing with an issue. Sometimes you just got to keep at it repetitively until you overcome your issues. So, again, Joel Palmer here at Vintage Fitness Studio of Vermont. And remember, life is heavy, train for life. We'll see you back here again another time. Take care. Bye.